you, Administrator Slavitt, for being here today. I represent a very rural district, in some parts more rural than others, in fact. 75 counties, touching 6 states. Obviously, we're very spread out. #1 agriculture district in the nation, very productive. Of the nearly 60 hospitals in my district, about 54 are designated as critical access. And that might be a single designation, but that's about 54 different types of expertise and providers, and I'm actually inspired by the work that they do, serving communities from smaller than 1,000 up to about 12,000 plus. Nonetheless, they've got a very large task, and I guess so do you. Can you discuss the feedback you received from rural providers in response to the initial RFI and how you addressed that in producing the rule, and then what rural providers and critical access hospitals can expect from this rule?
Yeah, thank you, Congressman. And in your district, and I think throughout the country, we face the challenge of not having enough physicians, in many cases, enough specialties, and there are many districts around the country where there are only 1 or 2 providers in certain specialties. So we cannot allow the sideshow that goes along with the practice of medicine to make the practice of medicine less fulfilling and less rewarding. So as it relates to the small physician practices, the medical home models that many of them are participating in, we've had really terrific feedback from, and I think what I hear from small physicians is give us the opportunity, find ways for us to have the opportunity to participate in some of these same opportunities and models that people do in urban settings, and make them work for us. So can you make changes to them that can work for us? That's, I think, one of the things we hear. And then on critical access hospitals, obviously for us, so many of our Medicare beneficiaries get taken care of and get treated and rely on those critical access hospitals. And the economics of healthcare in rural America is different than it is in other places. And that is both a short-term issue that we have regulations, as you know, to set up to deal with, but it's also a longer-term question around how those hospitals are structured, what they provide, and how we support them in the appropriate way.
Okay. In your response to the chairman, you had mentioned a reporting exemption for small providers. At the same time, I've heard questions from those who fall below the reporting threshold who would like to be able to report data. Will they have that opportunity?
So it's interesting you say that. I had that feedback last night in talking to a specialty society who said, we want our specialty to be more engaged in the practice of medicine with seniors. And so even our physicians who are only seeing small amounts, we want to do that. So I will tell you, I have heard feedback in both directions that I think our job will be over the comment period to take all that in and figure out how to do the best job accommodating the most types of practices possible.
Okay, well, I appreciate that. I know that the providers that I talk to are constantly not just to saying what the problem is, but to providing solutions and innovations, and I would hope that we can empower providers to care for their patients without the government getting in the way or messing things up. Thank you, Mr. Chairman. I yield back.
Thank you.